The number of cases of inflammatory bowel disease, or IBD, is on the rise around the world, shows the findings of local researchers. Industrialized countries, including Canada, have the highest rates of IBD, though developing turned industrialized nations such as China and India are also marking increases.
There's a condition or a theory called the hygiene hypothesis, which states that as we become more industrialized, we actually have more sterile societies, more sterile environments. And so when we were young, we don't get exposed to the same bacteria that we would have done hundreds of years ago, and that doesn't prime our immune system properly. So later on in life, those who have a genetic susceptibility to developing the disease may potentially then develop the disease. We've done a really, really good job of getting rid of infectious diseases, but in their wake there's been a number of immune-mediated diseases, including the inflammatory bowel disease, that have started to emerge, develop, and rise in our societies.
The impacts of IBD are not just the physical symptoms for patients. The disease is believed to cost the Canadian healthcare system about $700 million every year.
If this disease continues to increase and we don't have a better understanding, a better grip of how to manage the disease better, how to prevent it, this is something that will just continue to become more and more of a burden to society.
The efforts of Dr. Kaplan and his colleagues to lay the groundwork for further investigation is good news to Mark Ravai, who was diagnosed with IBD more than a decade ago, cutting his promising speed skating career short.
There's always so much research being done by the pharmaceuticals, trying to throw more drugs at it and make more money from it, but to actually have research focused on the cause of it and not just trying to mask the symptoms, I think is productive.
About 0.5% of all Canadians suffer from IBD. For Sun News, I'm Jenna McMurray.